How's it? Good crazy day ahead of us as usual. Just kidding. Nothing too crazy, right? What's up, everybody? I hope everybody's doing well. So, good afternoon or evening, valued viewers and trailblazers in the quest for health enlightenment. This is Dr. Joaquin Acosta, your guide and ally in the ever-evolving world of healthcare, streaming to you live from the heart of innovation. As the CEO of PharmTrue and your host for tonight's Know Your Pharmacist live stream, I'm here to take you on an intellectual odyssey, one where science meets compassion and knowledge becomes power. Tonight, we embark on a journey, exploring the intricate weave of healthcare's fabric. We delve deep into the recent revelations about the White House pharmacy. Interesting, right? A narrative that challenges our perspectives on responsibility and integrity within the highest echelons of medical administration. Using a whole lot of other insights and just some thoughts and opinions, we're going to be unraveling the complexities of this situation, providing a balanced, thought-provoking discourse without being perhaps, politically incorrect. Moving forward, guys, we're going to pivot to the revolutionary world of virtual healthcare. I'm going to introduce you to Sniffle, cutting-edge application reshaping the landscape of medical consultations. Literally all sorts of healthcare provider, telehealth, and more concierge there from the healthcare provider side, guys, looking at how that's changing that landscape there. Artificial intelligence literally harmonizing human touch and medical care. Very, very awesome. And in our Enlightenment Hour, promising to be a compelling session where we tackle the sensitive issue of the RSV vaccine resistance. We are going to be navigating the intricacies of public health and individual choice. In our Herbal Wellness Corner, we dive into the enigmatic world of cannabis. Understanding its therapeutic window, while we bridge the gap between scientific expertise and personal experience. Ensuring safe and effective use for all, guys. Therapeutic windows. Our community spotlight shines on the vital QPR Virtual Training held by the Las Cruces Suicide Prevention Task Force. Pretty awesome, underscoring Las Cruces' commitment to mental health and suicide prevention. Awesome community initiative, a close cause to our hearts and crucial in our collective journey towards wellness. Lastly, in the Men's Health Minute, we contrast Hims and Roman, two of the online telehealth services, and we're going to look at some insights into modern men's health services here and compare and contrast, guys. So we'll get into it, guys. Join me tonight on this educational crusade as we blend, empathy and expertise and innovation with tradition. So together, let's shape a healthier, more informed world where every individual is equipped with the knowledge and tools for optimal health. Tune in, engage, and grow with us. Let's make this not just another live stream, but a milestone in our collective pursuit of health excellence, guys. Remember, every step we take together is a step towards a brighter, healthier future. Let's begin with the journey, open-hearted and eager-minded. Welcome to Know Your Pharmacist live stream, where we transform healthcare one insight at a time, guys. Looking at this one, the White House pharmacy chaos. Isn't that right? You guys know the White House has a pharmacy? No, neither did I. Honestly, to tell you the truth. So let's take a look. The White House pharmacy was a mess. A new investigation found. There's a pharmacy in the White House, or at least there's a sign that says pharmacy. Though people in charge insist it isn't one, whatever they call it, the office has had enough internal complaints to warrant a government watchdog investigation. Here were the findings, which were hardly encouraging, apparently. One former White House pharmacy staff member told investigators that a doctor once asked if the staffer could hook up someone with a controlled substance as a parting gift for leaving the White House. The office dispensed controlled medications like Ambien and Provigil without verifying the patient's identity. Guys, Ambien for sleep, Provigil It's a sleep wake medication, usually for shift workers that have have to work overnights and things like that. It basically makes you stay out, right? Also let people grab over the counter medication from open bins. An upward of 640,000 in taxpayer funds were wasted in just 3 years, though that number is fuzzy because so many records were poorly kept and even handwritten. So if there's a pharmacy service there in the White House, guys, right? I mean, it literally has. I mean, unless they're not subject to the same pharmacy law that everybody else is, and controlled substance regulation, guys, that is insane, right? Giving out controlled substances, parting gifts, medication for sleep or wake or whatever they are, right? And I mean, over-the-counter medicine from open bins, I guess you could probably somehow find a way to make that a little less sketchy. But we're talking about the dispensing of the controlled substances without verifying people's identity, and the handwritten records and the weird records, and almost $700,000 in taxpayer funds. Jeez. The Department of Defense was the one who conducted the investigation. Their independent office of the Inspector General, the White House Pharmacy, was run by the White House Military Office and its associated medical unit. The probe was prompted by complaints of the Department of Defense received in 2018 about a senior military medical officer who was not named engaged in improper medical practices. Covers only activity in the office through early 2020 under the Trump administration, but investigators interviewed staffers who also worked there under former President Obama. The OIG report does not mention Rear Admiral Ronnie Jackson, the White House medical unit director from 2010 to 2014, and the president's physician through 2013 to 2018. He has removed his name from consideration as former President Trump's Veterans Affairs Secretary amid allegations about his lax prescribing practices and hostile work environment in the White House medical unit, some of which were confirmed in a separate 2021 investigation. So, where you look at that, basically a mess, right? Here, the CEO of the National Community Pharmacists Association, Douglas Huey, like the NCPA guys, for those of you who are in the professional pharmacy, obviously this is a basically known institution. But looking at this, right, comparing and contrasting, if this had been a traditional pharmacy, they certainly would have been cited by their state board of pharmacy, right? You could have literally your controlled substance license removed, or, that's my quote there, but there's probably even an outside chance that they'd be shut down by their state board of pharmacy if this was a pharmacy operating outside of the control of the White House, right? So whether or not they would have shut it down, they could have pulled their controlled substance license, they could have fined the living heck out of them. There's so many different things that, somebody who knows how to run pharmacies is insane, guys. Literally insane. White House medical staff also regularly ask for brand name medications like Ambien and Provigil instead of brand name, guys, brand name, because their patients prefer using brand name drugs. Like, where you really think about the difference between brand name costs and generic costs, guys, like brand name cost of something like Provigil, to the customer, you're looking at hundreds of dollars, right, for a 30-day supply. Same for Ambien. And that's just running up the tab for no good reason, because not only are these controlled substances pretty bogus. I mean, Provigil, the shift wake workers, sure, I get it, but Ambien, that's somebody, who really believes in the benefit of cannabis. I don't like the sleepwalking stuff. I don't like the other, habit-forming properties of things like Ambien, and the long-term use of it at all, right? So, if anything, it's just truly abuse, right? When you look at the cost of what it cost the government, they spent over $144,000 on those two drugs alone from 2017 to 2019, guys. You run the math on that. You talk about, let's say, an average 30-day supply for one of these medications at brand might be about $300. So about $145,000 divided by $300, that would have been giving almost 483 or 500 30-day supplies, right? If you look at the amount of pills that would have been times 30, That's almost 15,000 total pills, 14,500 doses. That's just estimating, guys. I didn't pull the exact deals there, but from somebody who's bought, and sold, and will be doing again in the future, a lot of, not only controlled substance, but medications. This is literally how the business of that goes, and that's pretty insane, right? That is an insane amount of medication. You can't have 15,000 pills unaccounted for, or just completely just given out just because some medical staffer asked, "Hey, I need an Ambien. Hey, I need an Ambien." 15,000 freaking times, 14,500. Somewhere in that roundabout, over 10,000 for people, I'm sure, right? Where you're looking at that. I mean, guys, the White House, 2021, 2022, Biden, what the hell is going on, right? Is, don't know what else to say there. That is a big time disappointment. I don't know if that's Hunter Biden there that is sitting there using all the Ambien and Provigil in the White House, or what that is, but oh my gosh, what a weird story for sure. Anyways, guys, I'm moving on. Let's talk about some more promising news. Wanted to show everybody the benefits of this app called Sniffle. Providers, not only physicians, nurse practitioners, this is going to be changing the game for a lot of clinical services that are being given now and in the future. Granted, if you're a provider and you're going to bill insurance and do things, you've got to get credentialed and things like that on your own, which is going to be separate from doing telehealth and selling cash services from telehealth. Obviously, if you're niche and you have something, really good going on with back-end services that are all kind of complementary, you can very much have a good chance of having a cash prescribing clinic, and avoiding insurance. But, how are you going to find those efficiencies? Guys, this one is pretty cool. Sniffle, right? So going over the app, your patients are losing patience, right? From rising costs to waiting weeks for appointments, managing care can become frustrating, for many. At the same time, patients have become more aware of the convenience of virtual care. In fact, from a recent study, 92% of patients shopping for providers now expect them to offer a virtual care option. Obviously, offer is an interesting deal. I don't know what study they cited for this, by any means. Obviously, probably in their better interests, but again, still probably something that's truly very true when you consider that, hey, we think having the chance that you would expect your providers to be able to meet with you virtually, as an expectation, at least sometimes, especially if you got that first appointment and you guys got an established thing going on, no problems. Obviously, cool stuff here from Sniffle, guys. So looking at, what this thing could be doing if you were a doctor, this literally able to do not only like your patient booking, but literally automates, right, all the administrative burden of, prescribing, right? Virtual consultation, full intake, health eligibility, HPI, family history at the conclusion of the visit. They receive their SN providers receive a detailed encounter notes and a scope note. So where you're really talking about that, physicians, like, this already comes with your scribe, right? And it already starts integrating some of that cool AI stuff into your appointments. And so you can, basically from the patient side, super cool. From the provider side, those providers that are looking to actually get out there and do your own clinic or expand your telehealth services, guys, if you are, looking at things, this one is pretty cool, right? Easy to grow the practice virtually, and where virtual appointments become very hard to manage when you're sitting there having to manage paperwork and things like that. Where Sniffle, doing all that work in-house, where you're actually having good notes. And so if you're a prescriber or a provider, right, you actually spend more time talking to your patient and not worrying about charting as you're talking, right? So things like that truly make a whole heck of a lot of a difference, right? AI diagnosis. This is cool. The process of identifying disease, condition, or injury from a sign and symptoms through the use of AI and machine learning, right? How does the technology help providers? Your patients sniffle their symptoms by interacting with the AI engine that receive an instant assessment. This takes place before the virtual visit and replaces a patient's typical behavior of Googling their own symptoms. The AI diagnosis is 95% accurate and gives patients a safe way to be proactive with their health. It also helps prevent cyberchondria, a form of anxiety associated with internet self-diagnosis. That's pretty cool, right? Including AI diagnosis as part of a virtual visit safely and accurately streamlines the process for providers, giving them more time to focus on patient care. And AI diagnosis provides a comprehensive intake which saves time and gives a provider visibility to an evidence-based potential diagnosis before the visit. So that's pretty awesome, guys. You get to the results, you talk to your doctor, you guys look at your AI diagnosis. The doctor can do their job, even better because of the prep, right? The prep done. And again, where you think about that kind of prep, you go into the doctor's office, you're getting obviously height, weight, all that stuff. Put in there your medical history based on conversations that you're having with the medical assistant or scribe, maybe whoever it could be, intern, and these are getting charted and noted, all based on whoever is listening and hearing this. So this takes that job and makes it that much more efficient, right? And backed by obviously AI, but you really look at how it really backs things. Designed to draw from over 12,000 sources, including reputable journals, guideline publications, WHO and CDC. These sorts of things here, truly do beat Google. They have databases that just tailor a lot of personalized medicine. And so the future of virtual care, absolutely got my endorsement there. Sniffle app. If I was a physician yesterday, I would already be, jumping on these kinds of things, literally streamline your workflows for all patient care. Yeah. Only, right now, even if you get your standard physician or medical provider, nurse practitioner appointment, telehealth, they can survive with a phone call and things like that, but the phone call doesn't necessarily record notes for them. It doesn't do the extra work. It doesn't help, tailor. You can log into your platform and see what the patient answered on all their questions, which is great, right? It's standard. But imagine where it takes that information and does an even 15 billion times better job at delivering that to you in a way that you can see it faster and start identifying things even that much more personalized to that person. Guys, that's Moneyball. That's insane. And not for, Moneyball by literally just dominating the stats and working towards some really unique things that are going to help people do a lot more with a lot less. And by less, I don't mean people. At the end of the day, this kind of AI, maybe where you say, does it replace a medical assistant or an AI or a scribe, right? No, not yet. But again, it's going to allow people to be able to do better person-on-person interactions, making sure things are going smoothly. And again, we know our nursing teams out there, our prescriber teams out there, our hospital teams, medical assistant teams, whatever care coordinators we know, could use a lot of extra assistance with this kind of stuff. For sure. Awesome. Sniffle app. All right, guys, let's move into a Enlightenment Hour segment talking about RSV, clinicians discussing strategies to deal with vaccine resistance. So, not a lot of people have gotten the RSV vaccine yet. And interestingly enough, this year, or 2023 last year was basically the highest year ever in RSV hospitalizations, and it's only continued to go up. So it's weird because RSV vaccines had gotten released, last year, and then they came out for our infant population after that. But again, pregnant mothers, new parents, and then even adults over the age of 60 haven't been the easiest population to kind of pull into the RSV situation, right? And the RSV vaccine, for pediatrics is reducing, I believe, that rate of severe hospitalization from RSV for infants by 70-80%. It's like, really good. And people going to the hospital for RSV because they had, they go because it's very severe. And those are the ones that you see on Facebook or wherever else that you know from your workplace, or unless it was you, that unfortunately has to go into the hospitals and watch your child have to have, breathing assistance and be very concerned for multiple amounts of days while your child is under close monitoring and recovery protocol, right? So thinking about RSV, it becomes probably a parent's worst nightmare that you never even thought of. But those parents who have to go through it definitely are seeing it, right? And so, looking at this, guys, in the 2022-2023 season, a significant spike in RSV cases was observed. As the 2023 to 2024 RSV season began, concerns arose that similarly high rates of RSV incidents and hospitalization were reported. Panel clinicians gathered to address these concerns and report preliminary findings. So, according to Dr. William Mueller, an early RSV season was observed in 2022. Cases began in August and September, peaked in October and November. In New Mexico, they actually in December, January. But he's talking about the United States. In 2023, rises in RSV case rates began in November, with peaks expected in January. Right now, this was written on January 17th. We're in the later half of January now, for sure. So, looking at that right now, nationwide, it's still a concern, right? Well, this is slightly earlier than expected. It is closer to the regular seasonality observed before 2022. However, the rates of reported cases are still high. Dr. Neil Silverman reported a rise in the rate of positive tests from 5 to 8% in California in the week prior to the panel. Silverman also discussed counseling pregnant patients about the risks to newborns and mothers. He has observed improved awareness about RSV in these patients compared to other conditions, as well as less resistance towards accepting vaccination against RSV. Dr. Laura Riley reported that while many pregnant women and mothers with toddlers sought RSV vaccinations, these behaviors were less common among new mothers, indicating a need to educate new mothers on the importance of vaccination. And again, this is, I still think, subject to the fact that RSV vaccine for infants and newborns has not just easily and readily been available for everybody. So maybe these are in populations where it was readily available, but I don't believe, RSV vaccine was truly available in Las Cruces. Like our pediatrician, Little Steps Pediatric, she didn't have it until probably a couple weeks ago. It was within the last 2 or 3 weeks. Forgive me for not remembering, but again, we finally got the RSV vaccine in. Our infant, about 3 months now, was able to get it. But we're happy that was able to be done, for sure. Something to be asked about. Unfortunate that it couldn't be done ideally before RSV season, but either way, thankful to get it done, because it does prevent 70 to 80% chance of preventing going for severe hospitalization at all with severe symptoms of RSV, right, guys? And so, the amount of education as noted by the drug topics, clinicians group here, of course, education needed in the older population, because there's the vaccine for the adults above 60, but and then there's infants and newborns. I'm telling you, the dramatic cases that you see of RSV are for infants, right? Whether you've seen friends on Facebook, Instagram, social media that have had RSV and their infants have had it, it's a nightmare, because they're ending up in the hospital. They're spending days in there, and it's actually a very concerning situation, right? I've heard that, at least from pediatricians themselves, literally that you would prefer COVID to RSV, um, for sure. But you get that vaccine, you really do prevent a lot of things. Whether or not the vaccine is actually available is another question. Pharmacies are typically not able to administer vaccines to infants or anybody other under 5 years old, sometimes 3 years old, and paid for by insurance. So you're not going to be able to go to your pharmacies and get that done. You're waiting for your healthcare provider clinics, your hospital clinics, to be able to actually have those things in stock. And then for you to ask about them, who's going to outreach to you, talk to you about them? Probably nobody, right? So that's why I'm, still pumping that and making sure that we get the information to the right places. I think RSV definitely, needs to be one of those that, is kind of a sneaky little booger there for our infants, for our new mothers, for our toddlers. It's frustrating. daycares, places like that where, truly those infants are spending a lot of different amounts of time together, guys. I think those are the places to go and focus about making sure that that it's available, right? And then actually having the people connected in the community that have it available. So, that's my RSV speech. Get the shots, infants, new mothers, hospitals, programs like that definitely need to be offering RSV vaccines, right? Even in the labor and delivery room, you should be doing education on that just as much as you'll be doing education on everything else that's going on. I think it's going to be that important. So, anyways, move in all on to the Herbal Wellness Corner segment, guys. Brought to you by High Horse Cannabis Company. As for High Horse, the director of training over there, having a blast doing that job. And doing that, we are still working on training and making sure we have the most educated, best advocate budgeters in the world, right? And starting with clinical education, with regulatory education, being able to apply, a lot of knowledge and things like that is really fun to be able to teach and translate that, guys. Always shop High Horse for all the best deals. Check out our pharmacist formulated one-to-one gummies for awesome things like chronic pain, cannabis naive, cannabis confused, cannabis curious people. You guys already know what's up. So, come our way. I definitely envision a world someday where we are curing, the opioid epidemic, where we are managing PTSD and mental health care, in way better ways, and using cannabis as a tool to help with that, and not, succumbing to the negative media that's talking about cannabis in the lights of, hey, this is really, screwing up mental health, and mental health is becoming worse because of cannabis, right? Let's figure out how to talk about therapeutic windows and dosing and endocannabinoid deficiency, and really looking at trauma and things like that, and why people even go there in the first place, right? And healing all the underlying things that are so much to consider. But guys, anyways, talking about this one for today, I want to talk about therapeutic windows when it comes to cannabis, guys. I think, obviously it's a very, easy to understand concept, but again, I think it's a very important thing here with all medications, but because cannabis is such a self-dosing, controlling thing there, an individual journey, understanding that the therapeutic window is the range between an effective dose and the dose that causes intolerable side effects. Your ceiling dose, right, is the place that you want to get to with cannabis. So to my new users, starting low and going slow, right? It's well documented that people who are new to cannabis naive, are more likely to experience unwanted side effects, while regular cannabis users are less likely to experience side effects. Why? Right? Various regions of the brain and tissues in the body can build tolerance to THC at different rates. Commonly, the therapeutic effects of THC are more resistant to tolerance building than the unwanted effects, guys. For example, areas in the brain that control movement and coordination may build tolerance to THC faster than the areas that control pain. So a new cannabis user with chronic pain may notice a reduction in pain, but have the side effect of feeling clumsy or unsteady. After a week of consistent use, the clumsy feeling may be resolved, but the pain relief remains. Right, the therapeutic window is a crucial topic there in that cannabis dosing, because it's, literally there's no upper dosage limit that has, toxicity, right? Toxicity being you're going to go to the hospital, right? You're going to have psychoactive effects that you don't want, but that upper limit effect is set by the side effect tolerability in each patient. That's what makes it cool. But again, getting to that point, understanding that point, not going past that point so people never want to use cannabis again, and being patient with the journey there in the therapeutic window is where it really, really is important, right? At first, especially in that dosing journey, 2.5 milligrams of THC in that wheelhouse and above, the therapeutic window is very narrow. Going up on dosage too fast can be problematic, because though patients may enjoy some therapeutic side effects, they likely won't want to deal with these unwanted side effects. Many first-time users who increase the dose too fast get turned off to cannabis and therefore fail to give it a proper chance. Cannabis almost always has a therapeutic window, meaning that desirable effects can be achieved without any unwanted effect. How? The first strategy is to allow THC to widen its own therapeutic window. For those new to cannabis, that means starting at a low dose, then increasing the dose gradually enough that one's body has enough time to develop tolerance to the unwanted side effects, while retaining sensitivity to the desired effects, guys. So, old rationale, start low and go slow. Absolutely it. Another thing you can do to widen that therapeutic window is use CBD with your THC, right, and actually help to mitigate a lot of those psychoactive effects and really continue to balance out that endocannabinoid system. Guys, that's my little preach today on cannabis therapeutic windows. Therapeutic windows with all medications, all supplements, but cannabis one is a journey, personalized journey, and oftentimes, hard to navigate alone. So I get that. We're here to continue to try to fix that and give you guys as much resources, as much education as possible. Talking to our bud tenders at High Horse, at Farm Juice, talking to me, messaging me, jumping on the chat, all of it, I hope can give you guys some sort of benefit, through and through, and we will continue to push that for sure. So anyways, let's move on to our community spotlight, brought to you by the Chicken Farm guys. Cool one here coming to you from our Las Cruces Suicide Prevention Task Force. Wanted to give them a shout out. Always a big deal in mental health right now. Everything like that. All jokes aside, Tyler Bass from the Buffalo Bills. Just kidding. No, but Las Cruces Suicide Prevention Task Force, guys. It's a virtual training, pretty cool, February 22nd, 2024 at 1:30 p.m. Question, persuade, and refer interactive training, 90-minute window class focused on suicide intervention and prevention. During the training, candidly discuss suicide, review suicide-related data, share some examples and experiences. Necessary stuff, very cool. Respect the community that is out there doing it, guys. I'm going to go to Las Cruces Suicide Prevention Task Force on Facebook. Check that out. Thursday, February 22nd, 2024. There's your resource, guys. And brought to you by the Big Farm guys. Lastly, we're going to talk about tonight, this evening, this afternoon, this rainy day, Hims versus Roman. So in our Men's Health Minute, brought to you by Water Speedway Park, guys. Just interestingly enough, these men's health services that obviously you're going to see the online ads for, the two big telehealth ones that are basically, erectile dysfunction, for lack of a better word. That's basically about, their main focus. But there's also telemedicine there that they are, secondary things that they're also doing, or primary things, hair loss and erectile dysfunction. Those are the big ones, but looking at comparing and contrasting these things, guys, I'll tell you right now, there's definitely places in town, Alpha Men's, where you can get all this kind of stuff, much cheaper. And again, if you're buying them just through the pharmacy at your local stuff, or even, your other plans there, you're going to get the drugs a lot cheaper than you're going to be getting them from these telehealth sources. They are overpriced, but if you do not do your shopping in preparation ahead of time for how to, even get your hair loss medications or your erectile dysfunction drugs, you're going to be suffering from, your wallet hurting, right? If you're using these kinds of services, but still have a primary care doctor that you just talk about, erectile dysfunction or hair loss, or, maybe this is the only health service you use because you saw an ad real quick and it was easy to just get the medication, right? Well, you should ideally be using these healthcare services to open up that conversation on your health, right? If you're finding that sexual dysfunction is occurring, right, what other health imbalances are going on? Probably a few. So we're, looking at Hims and Roman, right, and these online services. I'm just saying, talk to your doctor about it. If you're considering already using one of these services, or if you use one of the services and it's working for you, great, use it. But again, you could get it way cheaper by just talking to your primaries for it, going somewhere local in town like Alpha Men's, and actually getting the whole aspect of holistic, healthcare, regenerative medicine dialed in and taken care of for your health, not just isolating, a problem for sure. These are problems that are perfect ways to identify the fact that most men haven't been to the doctor in a while. Most men don't know their lives. Most men, right, don't know their health goals, right, for their age, right? So treat your body like a car. Go get those checkups, stay on top of it, right? Of course, it's different ways to think about that, but Men's Health Minute brought to you by Auto Speedway Park. That's what I'm talking about today. hymns and Roman could be great. Hope, if you're if you've had success, awesome. But I'm telling you, way deeper ways to go about it that actually, you know, would be able to fix those problems and look at the other stuff, holistic point of view. Guys, Dr. Joaquin, Tuesday, January 23rd, 2024, baby.